Welcome to EHI TV, eHealth Insider's Essential News on Video. I'm Shana Crispin, and today we're on top of the BT Tower in London for the official launch of EHI CCIO Campaign. As you may be aware, the campaign is about getting every NHS provider in the UK to consider appointing a Chief Clinical Information Officer. We've had a lot of representatives from a lot of different companies who have come to show their support for EHI's efforts today. And as of this morning, we've had 4 out of the 5 Royal Colleges who have pledged their support. It's obviously a fantastic start for the campaign, and we're hoping to get a few more people on board by the end. An audience of more than 70 representatives from the NHS, Royal Medical Colleges and IT suppliers heard from EHI's co-founder and editor, John Hoeksma, on the importance of the campaign. Paul Ultimen, the Clinical Director of Health Informatics for NHS South Central and Oxford Radcliffe Hospital's NHS Trust, has also urged people to consider what the creation of CCIO roles could do for NHS trusts.
One of the key other functions is to act as a sort of interpreter. Without someone who understands both sides of the technology, both the sort of clinical, deep clinical understanding and technical understanding, it's very difficult to translate between clinicians and the technologists. And one of the problems that I think many people have experienced over the last decade of trying to get these systems in is that you tend to make such huge errors in configuring systems that you disengage your clinical staff and lose them. So it's really important to be able to translate between all parties involved.
John Williams, Professor of Health Services Research at Swansea University, says introducing CCIOs into NHS trusts will ensure the wider benefits of IT implementations are taken into account.
We need the clinical leadership to make sure that we are taking a patient-focused approach, that the agenda is not driven by the corporate needs of the organisation, but is driven by the needs of patients, and to ensure that we look after them very well, and that safety is at the top of our minds. And that is very important from the health informatics point of view, because good health records, we know, do contribute to the quality of care and patient safety.
Meanwhile, BT Health's Chief Clinical Officer, Justin Watling, says it's time for clinicians to take a lead role in IT developments.
Yeah, at the end of the day, it's the clinicians that provide care to the patients, whether that's doctors, nurses or allied healthcare professionals, and they're the ones that use the information to change the way they deliver their care and the way they work with patients in their care decisions. So ultimately, it is the clinicians that need to take the informatics agenda on board. No amount of pushing it from an IT agenda will solve that.
Watling is also working with the BCS on developing guidance for trusts on the role of Chief Clinical Information Officers.
BCS, apart from just backing the campaign, actually want to produce a set of materials that you could give to a junior clinician to then consider beyond the campaign. So what does it mean for them, and how do they start engaging on that career path? What skills do they need to acquire, and how do they get to become a Chief Clinical Information Officer?
It's been a fantastic day here at the top of the BT Tower in London. If you would like to pledge your support, please visit www.ehi.co.uk/CCIO.